Thank you for having me, Olajumoke.
Right, so I want us to start from this video we just saw. Your partnership with ICPC is to monitor, track, and audit expenditures involved in the overhaul of health infrastructures across all local government areas of the Federation. Why has this become necessary?
Well, resources are limited. And in the last 2 years, we've seen deliberate effort by the federal government under the leadership of President Bola Ahmed Tinubu to increase investments in health, especially in the front end, in the primary healthcare system. That requires us to work with states, with local governments, and includes direct facility financing to thousands of primary healthcare centers all across our country. It requires revitalizing the physical infrastructure, the equipment in all those facilities. While many, I would say majority of our states, our local governments are doing all they can to ensure prudent use of those resources. We don't have the luxury of wastage or allowing unscrupulous elements in the front end to siphon those funds or misuse those funds. So as a preventive measure, we engaged with the ICPC in a preventive manner to improve the oversight over those resources. And when we disperse the Basic Healthcare Provision Fund, to also make it available that Nigerians are aware of what those resources are, where they are being channeled, and encourage communities, ward development committees members to take an interest to ensure they work hand in hand with the frontline health workers who are largely diligent, hardworking Nigerians in the front lines, to ensure the resources are put to good use and accounted for properly, to address institutional weaknesses, things like financial reporting, missing records, so that we can account for those resources and, in essence, stretch the limited resources that we have to go further, even while government is trying to enhance the investments that it is making in health, and to enhance the transparency as well as the accountability to Nigerians. So the National Health Fellows, for instance, are involved in keeping an eye on what is going on. We also have PFMOs in every local government. All in all, it's better to prevent the leakage and to deal with it after the fact. And we know that our systems are not perfect, and there would be challenges, but at least leaning in to try to preempt, rectify, address, and deter is our intent, because by the time the resources, let's say, are filtered, are misused, for instance, it's too late, especially for the amount that we're talking about. And we're beginning to see that making an impact, because the pace of revitalization all across this country has enhanced significantly. Not only that, we're seeing services being delivered to more Nigerians. So the limited resources are being put to good use. From our side is to give assurance also to Nigerians that what federal government is investing in health, and the more that it will invest, we will do our best to ensure it's put to good use to serve those who need the healthcare services in the remote areas, in our urban centers, all across Nigeria.
All right.
So it's a preventive effort. It's a proactive measure.
And I was also thinking about how bad the situation was before this partnership. But moving away from that, I've seen videos of you moving from Asia to the Americas in an effort to bring health sector investment into Nigeria. What can you tell Nigerians about any dividends they can expect from all of the strategic investment partnerships that you have established in recent times?
Yes. So health is one area where there is no country in the world that is an island, and no country has a perfect health system. Every country, the rich, the poor, we're all struggling to improve our health systems. So it's important that we're exposed to the wider world, to countries in Asia, countries in Europe, countries in North America, so that we can learn, but they can also learn from us, just as other African countries are also learning from us. But as we embark on those efforts, we also realize that it's a value chain. We need to manufacture certain commodities that we use, even while we may buy some from other countries. Now, to manufacture, you need to have the technology. You need to have access to the technology. For folks to come from outside and invest in manufacturing, they need to be sure that there's a market in your country and it's conducive. The reforms that the federal government has been undertaking is enhancing the attractiveness of the Nigerian market. We want to make the health sector to be a good destination for those investments. And what we have seen is tremendous interest, as you saw in our visits to Asia, as you may have noticed also in Europe, even in North America. There are entities that are now lining up to come and partner with local actors, in addition to what our local manufacturers themselves are doing to expand their businesses. So we think the health contribution to Nigeria's GDP will increase in the period ahead, thanks to the reforms that have been done over the last 2 years, and we're determined to continue to explore that. I'll give you several examples. Okay. For instance, the largest bed-net manufacturer in the world is planning to start to break ground in the southwestern part of this country of a plant that will manufacture not only for Nigeria but for Africa. There are major diagnostic equipment manufacturers that have agreed to expand, to provide those technologies to Nigeria and over time be able to assemble them. There are other ultrasound manufacturers who would start with assembly in our country. We're also seeing our domestic industry, thanks to the executive order that the President signed in June 2024, which is beginning to kick in for some of the local manufacturers of pharmaceuticals, expanding their plants, getting a little bit more comfortable that in fact it's worthwhile expanding in manufacturing because we are a viable market.
Yes,
and
Prof.
once you succeed in Nigeria, you are likely to succeed in Africa.
Absolutely,
so that's
Prof.
the import of all of those efforts.
Great move, and I mean, it's clear that these investments are good for us and also good for the investors. But some Nigerians are skeptical about the impact of foreign investments. I mean, there are fears that they may prioritize profit over the welfare of citizens. I'm wondering, how do you address these concerns and ensure that, you know, these partnerships generally prioritize public health and welfare of Nigerians?
Well, we have a lot of room for growth, and there's clearly an investment gap that we need to fill in order to grow at the rate that is necessary for us to get, for instance, over time to a $1 trillion economy, to achieve the prosperity that this country can have in its future. Now, the resources, of course, can come domestically, whether it's from tax revenues or private investors that are local here, and I think we need to prioritize those as well. But the investment gap goes beyond that. So the capital has to come from somewhere else. The role of government is to frame the policy and regulatory environment so that Nigerian public interest is protected, but that those who invest and take risks with their investments will be rewarded for those investments, so that we balance the public interest with the private expectation in terms of return on their investments. And that is the way that we can create jobs, manufacture the things that we need, become less import dependent, and get into the value chain to contribute our innovations so that we can even produce for other countries in Africa. And over time, perhaps we can even export to other continents if we're able to grow. We cannot be a totally import-dependent country when it comes to pharmaceuticals, biotechnology, devices, and even key health services. That is what the President, in fact, is putting on the table, and we're driving hard to execute it day in, day out. And we're seeing progress from domestic investors, our local manufacturers, but also from others outside. But we have to protect the public interest first. Nigeria's interest is paramount.
And I'm also, you know, looking at the mechanisms in place to ensure investor confidence. Because, I mean, I remember that under the presidential initiative to unlock healthcare value chains that you introduced in this administration, we've seen Bayer Pharmaceuticals sign on to establishing a pharmaceutical plant in Anambra State. There's also another one to establish a high-tech medical instruments production facility here in Lagos. But Nigerians are wondering whether this influx of new sector investment will continue. Are there financing partnerships or mechanisms in place to ensure investor confidence? Well,
it's a good question to ask. When we look at it, before now, 99% of our devices were imported. More than 75% of our pharmaceuticals were imported. So things are beginning to change. And the skepticism is normal, because when you change from a very low level of performance to the higher level of performance that this administration is pushing, naturally people are not used to that, and the skepticism will come. But what we are determined is to continue to promote and enable those investments to succeed. For instance, Bayer is a multi-decade major pharmaceutical manufacturer in Europe. Agreeing to sign an MOU with an indigenous company to set up a plant in Anambra State, for instance, is reflective of the confidence that they have on the Nigerian market, on the reforms of President Tinubu, on the sectoral agenda that were put in, and our positioning in the West African and African market. So I want to assure you that if we sustain this direction, the skeptics will over time become convinced that in fact Nigeria is moving. Right. But it takes time for those to manifest in a way that skeptics may feel very comfortable that in fact we're out of the wood.
And so what other investments can we expect in your sector?
Well, I've mentioned a few. I mean, the Bayer investment, I think I can say for sure. The largest bedroom manufacturer. There are pharma industry players that I wouldn't call the names of at this moment that are coming. The TB diagnostics manufacturer, we already have some that we had opened, let's say Codix Bio in Lagos and Ogun. There are others here in Abuja in partnership with Naseni. There is AMA. In fact, next week, we're expecting a senior minister from one of the Caribbean countries coming at the direction of their prime minister to discuss with a private entity here in Nigeria, in Kaduna, to look at what Nigeria is doing for their participation, but also exploring how we can tap into their market, how they may tap into our market. So those collaborations are active. And through PVAC, there are more than 70 investment cases. We are trying to raise the types of capital to match with those investment cases. It is a tough slog. It's not easy work, otherwise it would have been done. But we are moving steadily, and we're seeing good receptivity from private sector players domestically and also internationally. So we are very confident that this direction that our leader, the president, sent us on, I think is going to be good for Nigeria over the long run. All
right, Prof. You know, the last time you were on this program, we discussed funding, and if indeed the budgetary allocation is sufficient for all the, all the gargantuan projects you have in mind. And what I took away from that conversation is that funding is not enough, but we can do more. Recently, the health sector joint annual review, you announced that under this president's leadership, the Bola Tinubu administration, the Basic Healthcare Provision Fund has doubled in 2 years. We're talking about 131 billion naira in 2024 to 298 billion naira set for 2026. And this is coming at a time when the federal health budget has increased by 60% over the past year. So when you look at all of the progress being recorded in the health sector, how much of it results from increased resource availability, and how much results from policy innovation and reform?
It's both. I think we've tried to use what we have prudently, applying it in an allocatively efficient manner to the front end, to service delivery, to reach those who need it most. We also have used the additional resources from BHCPF, but also other sources of financing, multilateral financing, some grant financing, to deploy them in a way that will stretch us to deliver and reach more Nigerians. And we're beginning to see the results of that. That gives confidence to the finance ministry, budget ministry, but importantly to the president, to continue to prioritize health as we get into 2026. Because without those results, it will be difficult to argue that we need more resources. And we'll continue to drive that. The 8,800 primary healthcare centers that were benefiting BHCPF, now we're on the verge of adding 5,000 more, so that with the resources incremental, we can reach more facilities. And the equity angle to allocate more resources where the burden of disease is higher. And so there are many innovations that were put in place. that are demonstrating, in fact, responsiveness, not only in terms of confidence of Nigerians, as was reflected during the JAR, that is actually increasing, the quality that is maintaining at a higher level in those BHCPA facilities, but the fact that maternal mortality is reduced by 17% in the Mami local government areas in the last 2 years, and newborn mortality by 10% in those 172 local government areas. By no means to say that this issue is settled across the country or that there are no issues elsewhere. There are issues, but we're beginning to tackle them head on. Utilization has improved from over 10 million per quarter. The first quarter of this year, we have about 35 million. Second quarter of 2025, 46 million visits, not individuals, which means the confidence of Nigerians in utilizing primary health care services in areas supported by the federal government, but working together hand in hand with the states. All the state governors and their commissioners and their agencies are working with us, and local governments. Algon is keyed into this, is keyed into the president's health sector blueprint. So together, we're beginning to move the sector forward, and that's the direction, arguing for more resources at the federal level, but more resources at the states as well.
All right, Honorable Minister, the sector is moving forward, but resident doctors are on strike, and I wonder why. But I'll allow you answer that question when we return from this break, and when we return, this conversation continues on our other platforms. Please stay with us, everyone.